Dr. Nsubuga Fred, working with the Milestop as private sector engagement. Milestop, we aspire to ensure that all who want family planning services, they are one contact away from the service delivery point. What we know, the private sector in Uganda is wide coverage, and over 67% of the persons access services from the private sector. Working with them will enable Milestop to be able to fulfill or to ensure that all persons are able to access the quality services. However, the private sector has its own inherent challenges in terms of quality, in terms of capacity, in terms of the personnel, and it's poorly regulated. And more time, their data cannot be accessed from the public systems. We do take note about the national challenges where we have the high maternal mortality rate, the low contraceptive variance rate, the high unmet need, and the advantage which we have of the recent, we have increasing demand for family planning services. We purposively worked with the private sector to increase the access by equipping them with the skill, by giving them the knowledge on how to deliver quality sexual reproductive health services. We train them, we support them to access equipment, but also we linked them with the public system to be able to access the commodities. Additionally, we support them, their data, to be captured into the national system. In the last 1 year, we have worked with over 124 private facilities who have enabled us to reach over 150 mothers with the quality sexual reproductive health services. And of these, 32% are below the age of 20. Sustaining delivery of these services, we have equipped the private sector with the business management skills so that they can continuously deliver the services. However, also at the initial stages, we support them access the voucher system, which we are reimbursing to them for only mothers who cannot afford to pay for the services. And we think having administered the voucher for over the last 10 years, they've been able to accumulate some of the capital base to be able to run their own businesses. We have continued to support them, undertaking support supervision, quality improvement, and overseeing that their data is captured into the national system. As we are transiting, we have supported them to form their own business saving circles so that they can be able to invest, they can be able to upgrade their facilities. We have also supported them to do the self-regulation. Among them, we have pitted those who are champions, whom we have given the skills so that they will continuously support their colleagues to improve the quality of services. We are looking for continued data flow from the private sector to the national system where they can appreciate the work of the private sector.